Senator Lyons.
Deputy President, and I rise too today to talk to this matter of public interest and talked about the Ebola crisis that is facing West Africa, and indeed it is a problem for the world. And I must say, as Labor has consistently put on the public record, we acknowledge the Abbott government has made a contribution of funds. We acknowledge that. Senator Singh has acknowledged that. Our Shadow Health Minister has acknowledged that we have given funds. But funds, Mr Deputy Speaker, are clearly not enough. We cannot give money and then no personnel. And the view that we've heard from senators from the Abbott government this afternoon, quite frankly, makes me feel quite ashamed. This is not about people of their own free will volunteering. It is about Australia making a proper effort as a modern, democratic, well-resourced country to supporting those in West Africa. And as I've listened to the government a couple of weeks ago on a Saturday, I heard our Health Minister say that we would commit medical personnel if the disease reached New Guinea. Well, heaven help us if it gets that far, because we're all in trouble. And I could not believe that the Government of Australia, through its Health Minister, was seriously suggesting that that is when we would commit medical staff. I sat as I listened and could not believe what I was hearing, that someone in a very responsible position, such as the Health Minister of our country, could make that short-sighted comment. And I just wondered, Mr Deputy President, what was motivating that kind of response? Because as a rich, resourced, democratic country, we have some responsibility, as do other countries in a similar situation to us, of ensuring that West African countries do have robust health systems that can prevent these outbreaks. That is part of our responsibility. It's part of our moral responsibility. It's part of who we are as human beings. And then this morning, as I listened to the news, I heard this ridiculous assertion that tourism numbers in Cairns and other places had been dropping off because people were fearful of somehow contracting the Ebola virus. And then I thought, well, what is being created here? What is being created? Fear. And we heard Senator Di Natale earlier, as a medical practitioner, refer to that. And it is not appropriate for us to be evoking fear in fellow Australians. And I read also in the newspaper last Saturday of this horrific story of this young woman, 15, a girl really, who was really, she'd lost her mother and her father but didn't really know, but they'd gone and had been placed outside of a hospital because they couldn't get in. We all know the truth of this. And both her mother and father had died of Ebola. And this young 15-year-old was left without any resources because everyone in her village was then shunning her because her family had contracted Ebola and died, and she was left with very young siblings to care for, and one of those then subsequently died. And I put myself in the shoes of that family and was heartbroken, and yet we have this cold callousness coming from the Abbott government, and indeed some of the senators here today, that somehow, well, you know, if you want to go off and volunteer, off you go. That's not what this is about. As part of the Australian community, it is our responsibility to act as a country, to yes, give funds, and we've done that, but to also enable our health workers to go under the umbrella of an Australian volunteer, not a personal volunteer. But no, what we're seeing is this narrowing down, this we're only going to act in our regions, this closing of our borders. You know, we've now looking at stopping. We've stopped people from West Africa now being able to get visas, when really we should be looking forward and looking to how we can help. There's no doubt that there are not enough medical personnel working in West Africa. That now is the crux of the problem. And yes, we did have initially a problem about evacuating health workers from the region. But that isn't the reason to say no. That's a problem we solve. And we solve that by building field hospitals, by calling on other countries to support us. Because when we act as countries assisting in these sort of crises, we do act together. It isn't the Americans and the English and the Cubans. We are there together with our comrades and colleagues in West Africa, working together to defeat this virus. And that's what we have to do, because I, for one, don't want to see many more deaths in West Africa. These are people just like us, who have families, who have jobs, who want to live a full life, and they're dying. They're dying in huge numbers. And I, for one, want to be part of a community that reaches out and says, yes, along with our funds, you will also get our best medical personnel, because we are equipped to do this. And nobody's questioning whether our hospitals in Australia can cope with the crisis. We would expect that, and we have a right to expect that as Australians in a well-developed country, to ensure that we are adequately protected. But the reality is that we've now got 6,000 confirmed cases of Ebola in West Africa, and yet we sit on our hands, we start to be small-minded, we attempt to close our borders, we say things like we'll only look after those in our region. Well, that is wrong. We are part of a world community, and we have a responsibility to support West Africa, not only with funds, but with also medical personnel. And along with that tragic story of that young 15-year-old girl losing her family, we know that more than 2,500 people have already died. That's a crisis by anyone's imagination, by any stretch, by any measure. That is a crisis, and it's a crisis we need to act on. And health experts are telling us that the disease is increasing incredibly fast, and experts are predicting that 21,000 will be infected now. 21,000 infected now, and we must act to stop Ebola spreading, because we know, and the UN have told us, that there is a very small window to which we can contain this crisis before it gets completely out of hand. And heaven help if it ever spread to New Guinea, because do we think, I certainly don't believe that New Guinea or many countries in our region are equipped to deal with a crisis like that. It's a very short-sighted and uninformed view to suggest that that is when Australia will step in and help, because by then the whole world is in crisis. The time for us to be helping is right now. And we know, as other senators have said, we've got the AMA, the Australian Medical Association, urging the Abbott government to get on board and to help. And they're the experts in this. We've got our own government medical people telling us that we need to be supporting and acting with personnel in this crisis. We've got MSF out there, who are always one of the groups that are in the frontier, risking lives. There wouldn't be a crisis in the world that MSF are not actively participating in. Doctors and nurses, many of them from Australia, who are saying we must act. And the government could arrange for these volunteers to be attached to existing operations. Doesn't have to spend a lot of money setting up new resources. They could be attached to MSF. They could be attached to Red Cross. They could be attached to the UK or the US. There is no reason why Australia should not be committing personnel. And it is not good enough for the government to say, well, you can volunteer. We need to show as a country that we are committed to stopping this virus in West Africa, to saving lives so that children can grow up with parents, that we stop this disease right now, because the window starts to close in the next couple of years the next couple of days, before we well and truly have a crisis which will spread. And I would hate to see that happen. I would urge the Abbott government to get on board and look to how we recruit those desperately needed medical staff, and to do it very, very quickly, and to do it in the partnerships as I've just outlined Thank you, Mr Deputy President.
Thank you.